Have you ever thought about what it takes to turn a regular vehicle, into a mobile life-saving unit?
Yeah. I mean, it's pretty amazing when you consider all the equipment and supplies that go into making an ambulance ready to handle basically any emergency.
It's got to be way more than just a first aid kit and a stretcher.
Oh, yeah, way more. We're talking about a carefully curated mobile medical unit that's stocked to handle a wide range of situations. And it's interesting because not all ambulances are created equal.
I've heard about that.
You've got your basic life support ambulances, or BLS ambulances as they're called.
Yeah.
And those are kind of like the first line of defense.
Okay.
And then you've got the advanced life support ambulances, or ALS ambulances.
Like levels of care?
Exactly. ALS ambulances are essentially like mobile ICUs.
That makes sense.
Yeah.
So let's focus on the BLS ambulances for a bit, those first responders. What's their primary goal when they arrive at a scene?
I'd say the main goal is stabilization.
Yeah.
Imagine arriving at the scene of an accident. You need to minimize further harm, stabilize the patient, and essentially buy them time while getting them to definitive care at the hospital.
It's like damage control, but for medical emergencies.
Exactly.
So what kind of tools do they use to achieve that? I mean, I'm picturing bandages, maybe a stretcher, but I'm sure there's much more to it than that.
Oh, definitely. It's way more than just bandages and a stretcher. So first, you've got your airway and ventilation equipment.
Okay.
This is critical for helping patients breathe. You're talking oxygen tanks, masks.
Right.
And it's not just one size fits all. You need different sizes for babies, children, and adults.
Of course, makes sense.
And then there are those bag valve masks, which are those things you see in medical dramas where someone squeezes a bag to help a patient breathe.
Oh, yeah.
BLS ambulances also have portable suction devices, which are used to clear obstructions from the airway. It's pretty fascinating how much thought goes into preparing for every possible scenario.
It's true. I never really thought about all the different sizes they would need for everything, especially when it comes to kids. It's not one size fits all when it comes to saving lives.
Absolutely.
So what else stands out as essential in a BLS ambulance? What are those things that they absolutely cannot go without?
You've probably heard of AEDs, automated external defibrillators.
Yeah, those are used to restart someone's heart.
Exactly. And the technology has advanced so much that modern AEDs can actually differentiate between an adult and a child's heart rhythm and adjust the shock accordingly.
Wow. So they can be used on kids, too.
Absolutely. They're literally saving young lives.
That's incredible. It
Yeah.
seems like technology has come a long way in improving emergency care.
For sure.
So we talked about airway management.
Oh, yeah.
What about immobilization? You mentioned something about immobilization devices earlier.
Ah, yes. Immobilization is key, especially in trauma cases.
I can see why.
Think about it. Even a small bump on the road could worsen an injury if the patient isn't properly immobilized. So BLS ambulances carry a variety of devices like cervical collars to stabilize the neck splints for broken bones and head immobilizers to prevent further head or spinal injury.
And I'm guessing those come in different sizes for adults and children, too.
You got it. It's all about providing the right support for every patient.
So it's like a mobile ER.
Yeah.
Minimizing movement to prevent any more damage. I'm really starting to understand how vital this equipment is.
Yeah.
What about bandages and dressings? I'm assuming it's more than just basic first aid stuff. Right?
You'd be surprised by the variety they carry. We're talking burn sheets, wound dressings of all shapes and sizes.
Oh, wow.
Specialized occlusive dressings for chest injuries, even tourniquets. They have to be ready for just about anything from a minor cut to a major trauma.
Wow. It really is like a mini operating room on wheels. I never knew there was so much involved in equipping a BLS ambulance. It's amazing how they managed to fit all of that into one vehicle.
Yeah.
And what about communication?
Oh, that's essential.
That's got to be super important in an emergency situation.
Communication is vital for coordinating care. They use two-way radios to stay in constant contact with dispatch to receive instructions and to keep the hospital updated on the patient's condition.
Makes sense. It's a whole coordinated effort.
It is.
Okay, so we've talked about airway management, immobilization, dressings, communication. It seems like they're prepared for just about anything. But what about those unexpected situations? Like, what if they encounter a situation where they have to deliver a baby?
It's funny you should mention that because BLS ambulances actually carry obstetrical kits for those kind of situations. You never know when a baby might decide to arrive a little earlier than planned.
Are you serious? So they could potentially deliver a baby right there in the back of the ambulance?
It's definitely possible. The kits have everything they need. Towels, umbilical tape, a bulb syringe for clearing the baby's airway, and even a thermal blanket to keep the newborn warm.
That is incredible. I never would have guessed. So they're prepared for everything from broken bones to childbirth. Wow,
Being prepared for any eventuality is key.
that makes sense. So aside from the dramatic scenarios, are there things that might seem mundane but are actually super important?
Absolutely. Think about the tools that we often take for granted, like blood pressure cuffs, stethoscope thermometers.
Right.
You need them for almost every patient. And again, they come in adult and child sizes.
Yeah, of course. Huh?
And then there's saline solution, heavy-duty scissors flashlights. The list goes on.
Wow. It makes you realize how much thought goes into equipping an ambulance.
It really does.
You don't really think about all the little things until someone points them out.
You're right.
I imagine infection control is a big thing too, right?
Absolutely. Treating the injury or illness is only one part of it. They need to make sure everyone involved stays safe.
Of course.
And that means taking infection control very seriously.
Right.
So they'll have gloves, gowns, disinfectant solutions, eye and face protection.
Got it. So it's kind of like those airplane safety demonstrations, safety first. It seems like we've covered quite a bit here.
Yeah.
Is there anything else we should know about BLS ambulances before we move on to ALS?
You know, it's interesting because the equipment list can actually vary a bit depending on the community's needs.
Really?
Yeah, some areas might require specialized equipment for specific types of emergencies that they encounter more often.
That makes sense.
So a rural ambulance service might have different extras compared to one in a busy city, for example.
So it's about tailoring the equipment to the specific needs of the area.
Exactly. The goal is to make sure each ambulance is as prepared as possible to handle whatever comes its way. And that brings us to the ALS level, the next level of care. But we can delve into that after a quick break.
Sounds good. I'm definitely interested to hear more about what sets those ambulances apart.
Let's take a break and we'll get into that right after. So, you know, we've talked about all the essential gear that goes into a BLS ambulance.
Yeah.
But what happens when a situation calls for, even more advanced care?
Right.
Well, that's where ALS ambulances come in.
Go.
You know, those mobile ITUs we mentioned earlier.
Yeah.
They're really a step up in terms of the level of care they can provide.
So before the break, we were talking about, all the essential tools.
Yeah.
What sets ALS ambulances apart in terms of equipment? What kind of things do they have that you wouldn't find in a BLS ambulance?
Well, let's imagine a situation where someone's airway is compromised and they
Right.
need more than just a mask or basic airway maneuvers.
Oh.
ALS ambulances carry laryngoscopes.
Laryngoscopes.
Yeah, these are tools that help paramedics visualize the vocal cords so they can insert a breathing tube,
Oh, wow.
which is essential for patients who can't breathe on their own.
That sounds pretty intense. Is that even possible to do in a moving ambulance?
It is. Paramedics at the ALS level undergo extensive training so they can perform these procedures safely and effectively,
Wow.
even in a moving ambulance.
That's incredible. They also carry those breathing tubes, right? The endotracheal tubes.
Exactly. They have endotracheal tubes in various sizes for
Yeah.
both adults and children
Ah,
to make sure the breathing tube fits properly.
so it's not just about transporting patients, but providing that critical care on the go.
Yeah.
What other equipment sets ALS ambulances apart?
Well, let's talk about vascular access.
Okay.
Imagine a situation where someone needs medication or fluids urgently.
Okay.
An IV line allows paramedics to deliver these things directly into the bloodstream, but sometimes finding a vein can be tricky, especially in an emergency.
Yeah, I can imagine every second counts in those situations.
Absolutely. So for those tricky situations, ALS ambulances carry something called intraosseous needles.
Intraosseous needles.
Yeah, it sounds a little intimidating, but they're really incredible life-saving tools.
Okay, so what are those used for?
Well, think about it. In some emergencies, like severe dehydration or shock, finding a vein for an IV can be near impossible.
Oh, wow.
So these needles allow paramedics to deliver fluids and medications directly into the bone marrow.
Into the bone marrow.
Yep, and from there, it quickly enters the bloodstream.
That's amazing. I never knew that was possible.
It's a pretty amazing backup plan for those critical situations.
So they really are like medical MacGyvers out there, finding ways to deliver care even when the odds are stacked against them. It's incredible.
Yeah.
We talked about airway management and vascular access. What about cardiac care? I imagine they have some pretty advanced equipment for that too.
Oh, definitely. You remember those AEDs we discussed earlier?
Uh-huh.
Well, ALS ambulances take cardiac care a step further.
Okay.
They have portable monitor defibrillators that go beyond just shocking a heart back into rhythm.
Oh, wow.
These devices can actually monitor the heart's electrical activity and deliver pacing impulses to help it beat regularly.
So it's not just restarting a heart, but actually helping it to function properly.
Yeah.
That's amazing. It sounds like they have a whole mini hospital on board those ALS ambulances.
You could say that. They also carry nebulizers for breathing treatments, glucometers to check blood sugar, and even large bore needles for a procedure called chest decompression.
Chest decompression.
Yeah, it's a procedure that relieves pressure in the chest cavity in certain trauma cases.
Oh, wow.
And of course, let's not forget the medications.
Oh, right, the medications. I bet they carry quite a bit given the range of emergencies they handle.
They do. It's essentially a mobile pharmacy.
Really?
Yeah, they've got medications for everything from heart problems and breathing difficulties to pain management and seizure control.
That's a lot of responsibility.
It is. The specific medications vary by state,
No.
but they're carefully chosen based on the latest medical guidelines to make sure they're providing the most up-to-date care possible.
So who decides what medications and equipment go into these ALS ambulances? Is there like a master list they follow?
That's a great question. It's not just a random assortment of supplies. These decisions are actually made by expert medical organizations,
Okay.
like the American College of Surgeons, the American College of Emergency Physicians, and the National Association of EMS Physicians.
So there's real science and research behind it. It's not just about having the newest gadgets, but about making informed choices based on evidence and best practices.
Exactly.
That's good to know. And one thing I've heard about is the importance of age-appropriate care.
Oh, absolutely.
You know, children can't just get smaller adult equipment.
Right.
They need specialized equipment designed for their unique physiology and developmental needs.
Exactly.
So does that mean they have child-sized versions of everything?
Not necessarily, but it does mean that careful consideration goes into selecting equipment that's appropriate for younger patients.
Makes sense.
For example, remember those rigid cervical collars we talked about earlier?
Yeah.
The guidelines emphasize that for kids over 2, they really need those collars specifically because their necks are more delicate and require additional support.
Oh, wow. I didn't know that. And you mentioned AEDs with pediatric capabilities as well. So it sounds like there's a real focus on making sure children receive the right care.
Absolutely. It's all about understanding the nuances of pediatric care and equipping ambulances accordingly. This extends to everything from ventilation devices to medication dosages.
It's incredible to see the level of detail and thought that goes into making sure ambulances are prepared to help everyone regardless of age.
It really is.
You're right. All those little details can make a huge difference.
Yeah.
So we've talked about all this amazing equipment, but at the end of the day, it's the people who use it that truly make the difference.
You're absolutely right.
They're the ones making those life-saving decisions in those critical moments.
Couldn't have said it better myself.
Yeah.
Having the right equipment is essential, but knowing how to use it effectively and staying up to date on the latest advancements is crucial.
Yeah, that makes sense.
Ongoing education and training are vital for EMTs and paramedics to stay at the forefront of pre-hospital care.
So it's not just about the tools themselves, but about the skill and knowledge of the people using them.
Exactly.
I imagine there's always something new to learn in this field. It's constantly evolving.
Absolutely. Technology and techniques in emergency medicine, they're always changing and evolving.
Yeah.
Thankfully, organizations like the National Association of EMTs and the American Ambulance Association, they offer courses, conferences, publications, to help these professionals stay up to date on the latest in pre-hospital care. It's really inspiring to see their dedication.
It sounds like the world of ambulance services is incredibly dynamic and demanding.
It is.
And after learning about all the work that goes on behind the scenes, I got to say, it's been a real eye-opening experience,
I agree.
to see how everything comes together to improve patient care.
It really is a team effort.
Yeah.
From the medical experts who develop those guidelines
Right.
to the manufacturers who create the equipment, and of course the paramedics and EMTs who are out there providing care in the field.
They're the real heroes.
They are.
Speaking of teams, I know you work with RescueRide.
Yep.
Can you tell us a bit more about what you do and how you fit into this world of pre-hospital care?
Of course. So at RescueRide, we're really passionate about equipping EMS agencies, hospitals, and even individuals with the tools they need to respond effectively in any medical situation.
Okay.
So we offer a wide range of equipment and supplies,
Thanks.
from those essential items we talked about today to more specialized stuff.
So if someone's listening to this and they're thinking, wow, this is really fascinating, I want to learn more about this or even get involved, would RescueRide be a good place for them to start?
Oh, absolutely. We're always here to answer questions, provide guidance, help people find the resources they need.
That's awesome.
And, many of the supplies we've talked about today,
Yeah.
they're also really valuable for everyday first aid.
Right.
Having some basic bandages, antiseptic wipes, even a tourniquet in your home or car could really make a difference in an emergency.
That's a great point. We often think of these things as specialized tools, for medical professionals.
Yeah.
But basic first aid knowledge and a well-stocked kit can really empower anyone to provide that immediate care,
Absolutely.
in those crucial minutes before help arrives.
Exactly. And there are some fantastic resources out there for anyone who wants to learn those skills.
Oh, yeah, for sure.
Organizations like the American Red Cross offer first aid and CPR training,
Yeah.
and that can really make you a difference maker in your community.
You're right. Learning those skills is a great way to give back and potentially save a life.
I couldn't agree more.
Well, this has been an incredible journey into the world of ambulance essentials.
It has.
It's amazing how much we take for granted until we really take a deep dive into it.
You're telling me.
So thank you for shedding light on this vital part of the healthcare system.
It's been my pleasure. It's always great to share these insights.
And for our listeners, we hope this deep dive has been as insightful and inspiring for you as it's been for us. It's truly incredible to see the dedication, ingenuity, and compassion that goes into making sure we all have access to life-saving care when we need it most.
Well said.
So until next time, stay curious and keep learning.
I like that.